We've certainly been hearing about the severe shortage of medical staff throughout this crisis. Many doctors and nurses have described being pushed to their limits. And one doctor, Taylor Nichols, an ER physician with Vituity working at Mercy San Juan Medical Center, is coming forward with an admission, sharing in a series of Twitter posts that his compassion was called into question when a particular patient fell under his care. Now, Dr. Nichols tweeted he was solidly built, older, his methamphetamine use over the years had taken its usual toll and his teeth were all but gone. The swastika stood out boldly on his chest. SS tattoos and other insignia that had previously been covered by his shirt were now obvious to the room. Dr. Nichols is kind enough to join us now. Thanks so much for joining us, Doctor. Take us back to that moment, if you would. You've been working how many hours that week, and here's this apparent neo-Nazi with a giant symbol of hate on his chest who needs your help. You're Jewish. Tell us what happened next.
Yeah, thanks so much for interviewing, and thanks so much for asking. So it was obviously a little bit of a difficult situation, and he was significantly ill, and we had to intubate him, which is to put a breathing tube down his throat. And in that moment, I questioned how I felt about it, because being Jewish, seeing that symbol of hate, knowing that, that same compassion may not otherwise have been extended towards me if the roles were reversed, really made me double down and look into myself and extend that compassion towards him, do everything I could to save his life. And we did perform those life-saving measures and intubated him. But that moment caused me to question. I've never felt quite so challenged in that way in my compassion before.
And you say that we carried out this. The nurse with you was Black. The respiratory therapist was Asian. What was their reaction?
Yeah, unfortunately, it was a very busy night in the emergency department, and we didn't have time to debrief about it. But certainly everybody noticed, commented outside the room as we prepared, but none of us questioned what we were doing. We all signed up for this. We are, deeply compassionate and deeply passionate about what we do. And so we were going to go ahead and do, what we signed up for and work to save lives. But certainly it weighed on us.
You've been on the front lines of this crisis for months now. You've seen many Americans refuse to wear a mask, some questioning if the virus is even real. How has this pandemic really weighed on you and your colleagues?
That's the biggest question, and that's the hugest challenge to us, is that, we see the numbers rising. We see more and more cases coming into the emergency department. We see more and more patients getting sick and severely ill. What we really wish is that, just as we're digging deep and doubling down on our compassion, to extend that compassion towards others who may not even believe in this virus and may not be taking precautions, that I really wish, my biggest ask would be that people dig down deep into their compassion and take safety measures, take precautions, wear masks, and really do our best to double down and make sure that we do what we can to start to flatten the curve again. We see now with the vaccine seeking emergency use authorization that we know the end is in sight, and we know that we can save lives if we just follow the CDC guidelines, if we take precautions, and we can get through this, but we have to do it together.
You just mentioned your biggest ask. What's your biggest need in this moment? I mean, some doctors and nurses have been going on strike or threatening to do so over a number of concerns, calling attention to the lack of proper equipment and staffing shortages. Yeah. What would you say that you need most right now?
Honestly, I'd say that my biggest need would be the same. It's the same as the ask. It's that I need people to listen. I need people to believe us. I need people to really do everything they can now. And if it means not seeing your friends, not going out and just wearing masks, staying outside, following, again, the CDC guidelines to take precautions. That's what we need. We need to see that the numbers of cases go down. We need to see less and less of the severely ill patients who are coming in because of this virus.
Dr. Taylor Nichols, a heartfelt thank you to you and your colleagues for all of your tireless work and for sharing your story with us tonight. We really appreciate it.
All right. Thank you so much. I appreciate it.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.